It's not easy watching our pets grow old. The time we have with our four-legged friends is precious and definitely limited. The aging process cannot be stopped, but a group of researchers is working diligently to explain the effects of aging. Coming up on this episode of the Paw Report, we'll learn more on the Dog Aging Project and what's being done to help dogs and humans live longer, healthier lives together.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. I'm your host, Kelly Goodwin, and today we are talking about our aging pets and a big project that's happening nationwide. And here to talk more about our senior four-legged friends and this project that's nationwide, we have Dr. Saki Kadotani from the University of Illinois Veterinary Teaching Hospital. Thank you so much for taking the time to speak with us today. Yeah. The first question is the easiest. New guests to the Paw Report. We always put new guests on the spot. Tell us about yourself and your background and your journey to the U of I.
Yeah. Well, thank you so much for having me here today. Well, I'm Dr. Kadotani. I am a clinical associate professor of cardiology here at the University of Illinois. My journey in veterinary medicine started at NC State, where I received my Doctor of Veterinary Medicine in 2015. And after graduating, I completed a rotating internship at The Ohio State University, and I came here to Illinois to start my residency in cardiology. And after that, I received a board certification in cardiology through American College of Internal Medicine in 2019, and I've been faculty ever since.
Well, we are talking today about our senior pets, and we're going to launch into the Dog Aging Project, which you are heavily involved in. But first, let's talk about our senior dogs. What exactly makes a senior pet? How old do they have to be? Is the old adage for every 1 human year, it translates into 7 for our pets?
Yeah, that's a common question I get asked, and it may be a bit oversimplified, but it is true that dogs do age much more rapidly in their first couple of years, and I think the rate slows down as they get older, but it kind of depends on their breed and size. So for example, a Great Dane would be considered senior by the time they're 5 or 6 years of age, versus you're talking about small breed dog like Chihuahua, they might not be considered senior until 8 or 9 years of age. But I think overall, senior is about 7 years of age. But again, aging can be very, different depending on where, environment, genetics, lifestyle.
Mm-hmm. Older dogs do need special care and attention. Age is not necessarily a disease, but changes do happen when dogs age. Let's talk about that progress, that progression.
Yeah, you're absolutely right. Aging or age is not a disease, but aging does bring changes that can impact our dog's health and quality of life. So aging, just like in humans, I think the organs stop to work efficiently, the mobility decreases, and then brings on age-related changes like cardiac disease, kidney disease, and as they get older, they can get cognitive dysfunction.
Mm-hmm.
Yeah, so I think it's important to, for the owners to monitor these early signs and have veterinarians look at their pets so that we can catch these, signs of aging early to see if we can intervene sooner.
Let's talk a little bit about more how the pet owner can intervene and help and assist give their pets the best quality of life. In many of these interviews I've done, a lot of times we talk about pet owners keeping a diary.
Yeah.
They're going to know their pet better than anybody else. And it's important to kind of track and keep track of the quality of life that their animal is having.
Yeah, absolutely. I think, taking a journal, like you said, I think is a great way. And you're right, owners know their pet best. So when they think that, oh, maybe my dog is slowing down, but a lot of times they maybe contribute to aging, oh, my dog is just getting older. But that can be an early sign that there might be a problem emerging. So I think it's important to keep our pets lean and exercise, just like humans, right? We always get told by our physicians that, hey, make sure you're eating healthy, you're exercising frequently, and it's the same for our dogs.
Mm-hmm.
And I think regular veterinarian appointments, regular checkups with blood work, physical examination, and screenings like cardiac evaluation can be really helpful so that we can, find the subtle changes that can, potentially become a serious problems later on.
Is this something that they should address yearly? When you kind of ran through the list of tests, is that the frequency of something like that?
So generally for senior dogs, I recommend at least biannual evaluation. And so sometimes some of the diseases might not become apparent until they're very serious. And so sometimes that can only be detected on a physical examination. For example, a heart murmur, right? Dogs don't have to be showing any clinical signs to have underlying cardiac disease. That is the same thing with potentially kidney disease. You might not see any changes, but blood work might show that, hey, there's an early sign of kidney disease. Mm-hmm. And so, regular checkups biannually for senior dogs, potentially more frequent if they notice any clinical signs at home, just so that we can catch things early.
You mentioned big dogs and their life expectancy, Great Danes, you threw out that breed, but why do big dogs die younger?
Yeah, that's
it's almost like you would think sometimes it might be the opposite, because the bigger the stronger and the more stamina as opposed to the littler breeds.
Yeah, I don't have the right answer, and I think there's an active research going on, but what I know is that they just literally age faster. And so, what that means is that, they're more prone to getting these age-related changes much sooner, around, 4 or 6 years of age, versus some other breeds might be not getting those diseases until they're much older. And so it's really interesting that large breed dogs are just, more prone to getting these age-related, changes.
You have taken a very special interest in aging pets. It's kind of your thing, and that's what you enjoy studying and researching, which is one of the reasons why you were a part of this nationwide effort project called the Dog Aging Project. Can you give us an overview of that specific project and the cohorts that are involved in that, both humans and our four-legged friends?
So the Dog Aging Project is an observational longitudinal study, and this is where owners can sign their dog up online. So you can sign, as long as you have internet and smart device, you can sign their dog up. And through that, there's an online survey that they have to fill out to answer some questions about their pet, their breed, their age, lifestyles. And then once they're, enrolled in the study, the Dog Aging Project will send out potentially a data kit for them to collect and send that back to the laboratory to be analyzed. And then there's just an ongoing communication between the Dog Aging Project and the owner. So it's like a community science project. So anybody is welcome to sign their dog up to contribute to science and us learning more about dogs and as they age. And so it's a variety of people involved in this team, including veterinarians, veterinary technicians, researchers, ethnicists, and epidemiologists, geneticists. And so there are a lot of people involved. And of course, we can't do the project without our clients and our dogs that are in our research.
What magnetized you to this project?
Yeah.
And I think you might want to mention all the different schools involved too, not just the University of Illinois.
Right. So I think Texas A&M is leading the Dog Aging Project, and they have specialty interns and residents who are being involved with data collection, and there are different arms of Dog Aging Project, and I am part of the cardiac arm of the Dog Aging Project. And I've just been fortunate that I've know colleagues who are in the project, and they were kind enough to invite me to be part of the team as a collaborator. There are other schools like Colorado State University, University of Georgia, and then of course University of Illinois is one of them.
Now, part of that project, you said the project is kind of the main umbrella. Under that is the Triad clinical trial.
Yes.
What is Triad?
Yeah, Triad is an acronym that stands for Test of Rapamycin in Aging Dogs. It's a double-blind, placebo-controlled, randomized clinical trial, meaning that I don't know which drug the patient's receiving, the clients don't know what they're receiving, and also the people that are collecting data don't know whether the patient is getting a placebo, which is just an empty pill, versus a rapamycin medication.
And what is the specific purpose of that trial? Is it the fountain of youth?
Yeah.
I mean, we would all like to reverse the effects of aging, but that can't happen. So what is the specific purpose of the Triad trial?
Yeah. Really, the goal is to see if the medication rapamycin has any effect on aging and dogs' overall health. So the specific aim is to see if rapamycin has any effect on the lifespan, better cardiac health or heart health, cognitive dysfunction, and potentially mobility. So those are the 4 major areas that we're looking at.
So how long is the trial specifically, and is the Dog Aging Project maybe infinite, and this trial is has a certain time limit?
Yeah, so for the Triad, the active enrollment is about 3 years. With every 6 months, you come to a participating site like University of Illinois, and dogs that are enrolled in the Triad study will get a physical examination, a blood pressure, blood work, electrocardiogram that looks at the heart rhythm, and then an echocardiogram, and then in blood work. And then we have a screening visit where we make sure that patients are healthy and cardiovascularly sound before they are enrolled into the study. And the patient will receive a medication for a year, and then there's an observational period. But we see patients every 6 months.
Well, how would I know if my pet could be enrolled in this? What is maybe an ideal candidate?
Yeah.
And a pet owner may say, well, is there a cost to this? Is what's associated if I sign up for this type of trial?
And of course, it's completely voluntary. But the criteria that we look for Triad clinical trial is the dogs need to be over 7 years of age. They do need to be between 44 and 120 pounds. They have to be spayed or neutered and free of any significant systemic disease.
If we could go back to breeds for a moment, I know you mentioned Great Dane, but what are some of the other breeds that Maybe if you could maybe take us through, like, longevity breeds of a normal, lifespan, and then some of the larger breeds that, they age a little bit quicker.
Yeah. And so, I think, again, generally, I think small breed dogs do tend to live much longer. I mean, I have seen dogs that are 18 years of age and they are acting like a puppy. And of course, again, some large breed dogs like, Great Dane, Irish Wolfhound, right? Yeah, Pyrenees. And I recently met a giant Alaskan Malamute. They were bigger than me, and right, so those breeds are probably considered more of a senior age by the time they're 5 or 6 years of age. Yeah.
So the data that's collected in this trial, how is it going to be used, and is it something that the general public, can access once it's all collected and analyzed?
Yeah, so the dog aging project is an open data project. What that means is that whatever we learn, we can share to the world. So anybody who's interested in learning and getting new ideas from our data, they can do that. And so, of course, the dog aging project is really committed to protecting our patients' privacy and important information. But any data that we collect can be shared, and that way we can all learn from each other.
Dr. Kadotani, can we talk a little bit about going back to the ripamycin? Tell us about this drug, how it works, and maybe some of the promising effects that you've seen, because this is a really important part of this project.
Right. Rapamycin is becoming very popular both in human medicine and veterinary medicine, but the rapamycin blocks an important enzyme that plays an important role in cell growth, cell reproduction, nutrient uptake, and in survival. So in human medicine, it's FDA approved for the use of patients that have gotten, organ transplants to prevent rejection, as well as some chemotherapy. So they use it more for immunosuppressive medications. And both in human medicine and veterinary medicine, now it's being looked at for lifespan and improving aging, and then in some cardiac cases.
Are there any side effects? I'm trying to play the role of the pet owner, I'm sure you get a lot of questions. Why should I do this? Is it going to hurt my pet? Any side effects to the using this, or?
While there are reports of major side effects in human medicine, I think it's important to note that these side effects are seen at much higher doses. So these are considered more immunosuppressive doses. So some of the common side effects that are reported in humans included elevated triglyceride, which is one of the fat, in the blood, higher elevated blood glucose levels, some skin issues, and mouth ulcers. But again, these are only found in higher doses. And there's been a report of developing diabetes in humans who's receiving rapamycin in organ transplant patients. But it's important to note that in our clinical trial, the dose of the rapamycin is very low. So we're not near the immunosuppressive or very high doses. So while we can see, some mild side effects like vomiting, maybe decreased appetite, diarrhea, we haven't reported any adverse effects.
Do you think that this study, obviously focusing on our four-legged friends, can translate in any way over to us humans? I mean, is it something that whatever you study, there might be a light bulb go off?
Yeah, I think
so.
Have
you discovered that?
Yeah, I think so. There's, I think veterinary patients can be a model for human, medicine. And dogs do age much rapidly, which makes it easier for us to maybe collect data much quicker than, for example, humans. And dogs do get very similar diseases like humans, like kidney disease, dental disease, cardiac disease, cognitive dysfunction. So I think it can be translated to human medicine. We're still getting data and learning more about how aging affect our body, but I absolutely believe that our research can contribute to improving, human health as well.
Obviously a different species, but why dogs? Specifically for this study, and not cats, or both. I mean, I know cats are just a different animal, but any reason, or eventually maybe cats could be studied
absolutely.
as well?
Right now we're just focusing on dogs, and I think it's because dogs, again, like I said, dogs do age more rapidly, and they do get the similar diseases that humans get. And so I think it just makes it a little bit easier. They're more rich in genetic makeup, and so I think there's just opportunities for us to learn more from dogs. However, they are emerging rapamycin studies in cats. For example, there's a group of cardiologists that are looking at the effects of rapamycin in treatment of hypertrophic cardiomyopathy. So I am looking forward to the results of this study right now. But they are definitely, study of rapamycin in cats.
How is the whole project funded? I mean, could be another question that pet owners want to know about.
Yeah, so the Dog Aging Project and the Triad clinical trial are both funded by the National Institute of Health, or NIH, and private philanthropic donations.
Biggest takeaways that you could say from being a part of this project, and maybe some words of encouragement, advice, maybe some recruitment to people out there watching, saying, I do want to be a part of this. I always want to have a big dog, and if there's something that we can do to help them live longer, let's do it.
Yeah, so I think the biggest takeaway is that aging is multifactorial, and it's can be affected by environment, their lifestyle, what they're eating, and also breed and genetic makeup. And I think what I learned the most is that owner observation is so critical, and in identifying these early subtle changes of aging can be very helpful in helping veterinarians detect these early signs of disease that we can, and hopefully with right treatment and care we can prolong our pet's lifespan. And we are continuing to enroll our patient. Again, it's voluntary. There's no, money involved, and all the cardiac evaluation, at least through the Triad study, is covered by the study. So it's really just the travel that they have to do, but otherwise everything is covered by the study, which is, wonderful that we have funding to be able to do that.
Yeah. If someone enrolls their pet, how much time is spent on their part doing the data collection? Is it something that they have to monitor maybe once a week, once a month, once every 6 months? How is that, because somebody may be out there saying, I just don't know if I have the time to do that. Is it very time consuming?
No, and it is, again, you can do it at the comfort of your own home, and you can do it at your own pace. So there's no, you have to have this done by this time. It's really at your own pace, voluntary as much as you want. And so I think it's probably not going to be as time consuming, and there's no timeline or time limit that you have to get these done. So
we have just a couple minutes, so let's put a bow on senior pets and maybe the best advice that you could give to pet owners out there, and also maybe some of the studies and clients that you've seen over the years that you're the biggest cheerleader for our senior dogs. Let's wrap it up. What's the best thing that you can tell pet owners out there?
Yeah, I think really keeping them lean is really important, and getting them exercise, and consistently, and not just on the weekend we go on a hike, right? It's a consistent, everyday, small little bit of exercise is important. And making sure, I think, nutrition is important just like it is in humans. They are a special diet for senior dogs that are specifically formulated to, meet their changing demand. So they're a little bit lower in calories, and it's got, important nutrients to support their aging. And again, I think regular checkups. I can't emphasize enough about importance of going to see your favorite veterinarian at least twice a year to make sure that we can evaluate, do a physical examination, catch any subtle changes that maybe the clients didn't notice, and making sure that we can implement the right, treatment if we find any problems.
A great way to end this segment. Dr. Kadotani, thank you so much for
much.
joining us and talking about our senior four-legged friends. Some fabulous advice, and best of luck with the study ahead.
Yeah, thank you so much.
And thank you, our viewers of the Paw Report, for joining us for this episode. Until next time, I'm your host, Kelly Goodwin. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.